In this Service 7, we focus on helping physicians achieve top patient satisfaction scores. As you know, your reimbursement is increasingly influenced by patient satisfaction surveys, and only the best scores count. Here are 7 ways to make sure your scores reflect the high-quality care you provide. Number 1, physician satisfaction is the foundation for patient satisfaction. 1 in 3 doctors suffer from burnout. Stress and fatigue can all negatively impact the single most influential point in patient satisfaction, the quality of one-on-one interaction between doctor and patient. If your own personal satisfaction level isn't a 5, think about the first thing you'd change and do it. You'll see improvements in patient satisfaction and your bottom line. 2, lead by example. Not only do you direct patient communication, you play a behind-the-scenes role in coordinating care and influencing the care team's interpersonal dynamic. Your performance sets a precedent staff will follow. 3rd, don't overlook your appearance. Surveys show most people, especially those over 45 years old, prefer doctors who wear professional attire, with or without white coats. This is less important to patients for surgeons and practitioners in emergency medicine. Number 4, taking the time for meaningful conversation is essential. The BATHE survey is an interview format that can make patients feel more valued. It allows the physician to assess the background situation, the patient's effect, the problem that is most troubling for the patient, and the manner in which the patient is handling the problem. It concludes with a response that conveys empathy. Research shows even a 5-minute conversation is impactful for the patient and doesn't significantly increase time spent per visit. 5th, the patient-provider relationship is an important factor. Patients expect comprehensive, correct information delivered with respect and sensitivity. Even one negative encounter can shift a patient's entire perspective, and it happens far too often. In satisfaction studies, complaints about a lack of patient-provider relationships often far outweigh patient safety and administrative concerns. Number 6, empathy. Clinically speaking, 2 types of empathy are required to provide high-quality care. Cognitive empathy, which recognizes and considers a patient's emotions when making care decisions, and affective empathy, which internalizes and truly feels those emotions. Providing the empathy patients want while maintaining sufficient detachment to make the right decisions is a delicate balance, but patients who give perfect empathy scores also report better outcomes. And finally, humor can be a subtle way to express dissatisfaction with patient behavior, provide reassurance and relaxation, or command attention. Well-placed jokes help overcome communication roadblocks, connecting you and your patient on common ground. That's it for this edition of Service 7. Try these strategies, and your patient satisfaction scores will reflect your excellent standard of care.